we have on the stage two speakers, Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of the Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Au will first give you an account of the confirmed cases. Good afternoon, Hong Kong citizens, friends of the media. I now report the latest information about COVID-19 cases confirmed by the Center for Health Protection on the 26th of March. Yesterday, we recorded 3,555 PCR positive cases, case numbers from 719353 to 722907. Of the 3,555 PCR positive cases, 551 were confirmed by the Hospital Authority, 346 by the Public Health Laboratory Service, and the remaining 2,566 cases confirmed by private laboratories. On rapid antigen tests, 4,482 cases were confirmed to be positive via RAT. As of yesterday, we recorded 8,037 positive cases in Hong Kong. So far, cumulatively, since the start of the fifth wave of the epidemic, we've recorded 1.115871 million cases, including 710,270 PCR positive cases and 405,606 RAT positive cases. Of the confirmed cases yesterday, there were 2 imported cases, and the remaining 8,035 being local cases. The Public Health Laboratory Service conducted genome sequencing for 1,040 cases, and no L452R case was identified, and 1,023 cases were found to be negative, meaning that they're Omicron cases, and for 17 cases, they have low or insufficient viral load. Regarding residential care homes, we had 1 more residential care homes for the disabled involved so far, affecting 1 staff member and 1 resident. No RCHE was further found to be affected, and so far 783 residential care homes for the elderly had cases or outbreaks in the past 2 weeks. Cumulatively, and 38 of these cases had outbreaks in the past 2 weeks, accounting for 4.7%, involving 750 residents and 136 staff members. On residential care homes for the disabled, in the fifth wave, altogether 285 residential care homes for the disabled have had outbreaks or cases, and 19 such homes have had cases or outbreaks in the past 2 weeks. And that is 5.7% of all the RCHDs in Hong Kong, involving 228 residents and about 120 staff members. Regarding death cases, in the fifth wave, so far we've recorded 7,039 deaths, up by 151 comparing to the tally yesterday. The fatality rate overall now stands at 0.63%. 4,193 were male, 2,846 were female, aging between 11 months and 112, with the median age being 86. There were 8 pediatric patients and 273 cases of death involving adults from 18 to 59 years old, 3.9%, and 6,755 cases belong to the age group over 60, that's 96%, and 4,998 cases involved elderly people above the age of 80, that's 71% of the overall deaths. 89% of these cases had chronic illnesses. On vaccination status, 89% of all death cases had no vaccination record or only had 1 jab. For elderly people above the age of 80, As high as 91% of the deceased had no vaccination record or had only one jab. The fatality rate for the unvaccinated or those who received only one jab is 1.87%. As for those who had 2 jabs or more, the fatality rate is 0.1%, so that's a 19-time difference. As for elderly people above the age of 80, for the unvaccinated or those who received one jab only, the fatality rate is 11.83%, and for those who received 2 jabs or more, the fatality rate is 3%, and that's a 4-time difference. Dr. Lee will now report on the HA situation. Good afternoon. At the moment, we have 10,841 confirmed cases receiving treatment at public hospitals: North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and AW Community Treatment Facility. We recorded 30 patients in critical condition last night. 14 of them had no vaccination record and 47 in serious condition, and so far 110 critical patients are receiving treatment in ICU. As of midnight last night, over the past 24 hours, 130 patients who tested positive passed away, and they were 78 males and 52 females, aged between 57 and 108. 72 of them were care home residents. 78 had no vaccination record. 40 had 1 jab. 10 had 2 jabs, and 2 of them had 3 jabs. And there are also 4 cases above the age of 65, and I'd like to report on younger patients' cases. First, a 59-year-old male had no vaccination record. He suffered from hypertension, diabetes, heart disease, and renal failure, and he earlier had an organ transplant. On the 11th of March, he went to Alice Ho Miu Ling Netherlands Hospital A&E unit, and he tested positive. He had shortness of breath, and he also suffered from pneumonia and was found upon X-ray examination. After hospital admission, his renal function continued to deteriorate, and he also had a thyroid problem, so dialysis was arranged in the hospital, and in light of his COVID situation, he was prescribed with steroid, remdesivir, and other medication. But his condition had continued to deteriorate. Despite the high-level oxygen support, he continued to have shortness of breath. He was then transferred to the intensive care unit of Prince of Wales Hospital, and yet his condition continued to deteriorate, and he passed away on the 26th of March in the small hours. Second patient, 60-year-old female, no vaccination record. She had hypertension, and she also suffered from cancer. She visited the A&E unit of United Christian Hospital on the 16th of March, and on the 10th, she was found to be positive via RAT, and she had pneumonia upon X-ray examination, and she also had some coughs. She was prescribed with antibiotics, steroid, and remdesivir upon hospital admission. Her respiratory system failed despite high-level oxygen support, and her condition continued to deteriorate, and she passed away at 4 a.m. on the 26th of March. Third patient, 57-year-old male, no vaccination record, and expatriate. He suffered from diabetes and hypertension. He went to the A&E unit of Kwong Wah Hospital in the morning of the 21st of March. He had stomach ache. He felt weak, and he also tested positive via RAT as well as PCR subsequently. An X-ray examination showed he had pneumonia. He was transferred to Queen Elizabeth Hospital on the 23rd of March for admission, and whilst in Queen Elizabeth Hospital, his condition was relatively stable. He did not need oxygen support. But on the 26th, he had a cardiac arrest, and upon resuscitation, was administered in vain, so at about 5 a.m. on the 26th of March, he passed away. The fifth patient, or rather the fourth patient, was a 60-year-old male. He did not have any vaccination record. He also suffered from a terminal stage cancer. On the 26th of March, he, in the morning, went to the A&E unit of Queen Elizabeth Hospital. He had poor appetite, and he became unconscious at home. And in early March, he was found to be COVID positive. And then paramedics performed resuscitation. He was intubated in A&E unit, but to no avail. And on the 26th of March in the morning, about 7 a.m., he passed away. Finally, a 57-year-old male, no vaccination record. He was a care home resident. On the 25th of March, he went to the A&E unit of Princess Margaret Hospital because of shortness of breath. In early March, he tested RAT positive. So his condition was poor upon arrival in the hospital. He had the shortness of breath and also low blood pressure and pneumonia. His condition deteriorated, and at 9:10 a.m. On the 26th of March, he passed away. Because of data lagging, I'd like to report 21 more deaths, including 9 males and 12 females aged between 37 and 105. 828 patients have recovered were discharged upon recovery, and 6 patients were found to be positive upon admission screening. We had 12 close contacts in the hospital wards, and so far 20,782 staff members of HA have been affected. 17,198 have resumed their positions.
We now have a Q&A session. Please tell us which organization you represent before we give you the microphone. I'm from TVB. Now we are now in the four-digit territory in terms of confirmed cases, but still we see many people going out, and it seems that there are more. Professor Gabriel Long, we're going to have a rebound. Are we going to have a 6th wave, or are we going to see some fluctuations later? Well, we have 8,000 or so cases, which is not different from what we saw yesterday. So for 2 consecutive days, we are in the territory of under 10,000. This is a good phenomenon. It shows that things are getting stabilized. But we are talking about $8,000 to $10,000 per day, which is a rather high level. So we don't have any prerequisite conditions to relax the measures. I understand that we have been fighting the epidemic in such a strange way for 2 to 3 months. People are feeling some fatigue, but this is a critical moment. I hope everyone should observe the social gathering restrictions, and elderly people should stay at home as far as possible, and we should not have gatherings involving multiple families, because if we relax now, the chances are that we are still having a lot of communication transmission chains in the community. And if you go to restaurants and other public places, more cases will come our way, so there might be a rebound. I hope everyone will remain vigilant at present. I'm from Apple Time. According to local doctors, the mainland help is no help. That these helpers are not helpful at all, and they have to monitor how they carry out their duties. So, can you tell us the situation at AWE? And Professor Gabriel Leung saying that there are people being passed around different facilities. Why is it so? And it seems that there are some more cases involving the multiple family gathering. What will be done about these cases? The mainland helpers have arrived for some time already. We do have an arrangement to make sure that they can blend in, they can cooperate and work under our systems. We have, for example, provided a Chinese interface of our computer record system. and we will also do the right proper division of labor so that we can cooperate with each other. Actually, the cooperation is a close one, and we work in tandem with them as a team. I'm sorry, what's your second question? Professor Gabriel Leung, and the interpreter cannot hear what the remaining part of the question is because he doesn't use a mic. I think things are progressing smoothly. If an elderly person is in fact confirmed to be an infected patient, he can be sent to a holding center. And I know some homes would take care of these elderly residents in the holding center. And if the situation and the conditions are poor, they will be admitted to a hospital. On the discharge protocol, if they have to return to a residential home, then on the 6th or 7th day, the RAT test should be negative. If the conditions are stable, but still the RAT test is positive, then they will be sent to a holding center or isolation center, or to the AWE, the community center. As for the number of confirmed cases, when the Department of Health received a notification, then we would act in accordance with CAP 599A, issue an isolation order, and I hope the relevant person would comply with the order. If they violate the violation order and leave the premises specified in the order, we would take action. We would carry out spot checks. We just hope that everyone would comply strictly with the isolation order. Good afternoon. I'm from Now TV. With regard to one particular death case, a 57-year-old man who went to QEH and the resuscitation failed and he died. Well, is this case related to COVID-19 infection? And I know HA is trying to get more helpers from the mainland. What's the utilization rate like at AWE? Are you going to provide more beds, therefore you need to get more helpers from the mainland? And you are going to provide vaccination service to the elderly residents of different homes? Have you started this? Have you started this programs yet? And for Kwang Fuk Estate, we have a number of buildings subject to the RTD. Are we talking about a particularly high-risk area there? As for the AWE situation, we have 20 doctors and 100 nurses, and additionally, 400 colleagues, helpers from the mainland working there. We work at hall number 8 and number 10. Altogether, we are taking care of 350 patients. As I've said, the operation has been smooth, and we hope in due course, very shortly, we can work up to our full capacity, which means that we can take care of some 450 patients. But do we have a plan to further ask for the help from the mainland, or are we going to open more halls for our operation? Well, we have to take into account the relevant conditions. For example, where the epidemic situation is progressing. As for the case you refer to, 57-year-old man is an expat. He was admitted to Kwangwa Hospital. It was not a very obvious case of upper respiratory tract infection. Well, he was feeling weak. And then when he was tested positive, he was transferred to QEH, Queen Elizabeth Hospital. The conditions were said to be stable. There was no shortness of breath, there was no need to give oxygen support. We are not sure whether there was a cardiac arrest, so we are not sure whether he died of COVID. But when he went to the A&E for help, his conditions was not very stable. Let me talk about the A&E service. With the designation of some hospital for COVID patients, admission of A&E patients has become smoother. Of course, we are facing tremendous pressure. Where things have improved at our A&E departments quite significantly. The waiting time has been shortened. But if people feel that they are not feeling well, or especially elderly people who have some bad physical conditions, shortness of breath, or cramps, or the face or the lips are turned purple, indicating low oxygen in blood, then we advise all these people to see a doctor as soon as possible to prevent deterioration.
About vaccinating elderly people, earlier, Mr. Nip, Secretary for Civil Service, already explained the upcoming arrangement to be implemented. So I think the Civil Service Bureau will give further details in due course. At the moment, in order to control the epidemic, we need to reduce deaths, severe cases, and infections. For the elderly population, we need to arrange for the elderly people to get vaccinated as soon as possible because of the high fatality rates once they are infected with COVID. Now, for residential care homes in the past 2 months, a lot has been done to boost the vaccination rate. Meanwhile, we need to be mindful about the vaccination rates for elderly people in the community. And the government would like to walk the extra mile to encourage elderly people in the community to get jabbed. Now, for RTD operations, government departments will dispatch colleagues to get information from household tenants, and through these operations we will have an idea how many elderly people have yet to be vaccinated, and if necessary, help will be offered. The relevant government departments will give a full account in due course. As for Kwang Fuk Estate in Tai Po a few days ago, according to our sewage surveillance, the EPD found high level of the virus in the sewage sample. So on different dates, RTD operations were mounted against different buildings. According to the latest figures, some 400 cases have been identified in the estate, and the RTD operation is still ongoing. The positive rate is, or the confirmed case rate is about 5.5%, which makes us believe that there could be transmission within the estate. If necessary, these confirmed cases will be arranged to be isolated in community isolation facilities, while the household contacts will observe quarantine at home. Next, this gentleman. Good afternoon. I'm from News. Now, according to experts, next month, on the 21st, in the first phase, when the government relaxes social distancing measures, there could still be some 4,000, 5,000 confirmed cases daily. Members of the public are concerned whether the anti-epidemic efforts will be relaxed upon relaxation of the measures. Other ways to prevent a rebound. And about reducing deaths, severe cases, and infections, has the government encountered any difficulties, and are there any areas of improvement? And another question, some elderly patients still test positive after being sent to isolation facilities or hospitals. It is said that they should be arranged to be further isolated in holding centers. According to media reports, residential care homes would like to approach the holding centers, but have been told to contact individual holding centers. Will there be a one-stop service so that patients will be transferred directly from hospitals to holding centers? And also from media reporting, some cleaners claim that they do not have sufficient protective equipment, and they're only given a few masks by the FEHD and no PPEs. Well, after all, they are working at the front line, helping us fight the epidemic. Will there be a higher level personal protective equipment for them? About the epidemic situation, we continue to observe the daily confirmed cases and conduct risk assessment. In the future, we do hope that this current trend will continue and will continue to see a continuous decline. However, we don't have the crystal ball, so we need to keep in view the situation. At the moment, we have 8,000 to 10,000 confirmed cases every day, and this is a rather high level. Although there has been a decline from the peak level, we're still high on the plateau, and we need to be very careful and observe the trend in the coming weeks. The government, meanwhile, will conduct risk assessment and decide whether social distancing measures can be relaxed and to what extent. I do think that this will be done in phases and progressively. The social distancing measures won't be lifted once and for all. And the measures will only be relaxed on the premise that the epidemic situation is under control. If there is a rebound, then we may not be able to relax these measures. So at the moment, what is of importance is for members of the public to continue to observe social distancing and also get tested as soon as possible. We hope that all infected cases can be identified as soon as possible so that public health measures can be implemented to prevent the further spreading of the virus and for the case figures to drop. On reducing deaths and severe cases in the past month, we have done a lot, especially with the staunch support of the central authorities and also support from the mainland medical support team. We have more treatment and isolation facilities operating in the community to reduce the number of severe cases, and if there are severe cases, they can be treated in a timely manner. On protective equipment, the Center for Health Protection has this strategy. In terms of COVID-19, we have guidelines for different sectors of the economy to fight the epidemic. And we also appeal to these sectors to follow the guidelines promulgated by the Center for Health Protection, especially on protective equipment. In a recent week, we have been operating more beds in holding centers. We now have a coordination mechanism. If the patient is suitable to be discharged, and yet he is still RAT positive, he can directly contact the social welfare department or residential care homes for the patient to be transferred to the holding center. And after staying in the holding center for a while, if he tests negative again, he can be sent back to the residential care home. And in fact, the residential care home can also contact our outreach team for us to provide on-site support. And if necessary, oral medication can be prescribed. The coordination mechanism and the holding centers have been in operation for some time, and I believe once we're familiar with the process, it will be even smoother. In terms of severe cases, holding centers belongs to one tier of the multi-tier and triage treatment strategy. Now, if we have critical patients requiring hospitalization, they can be sent to public hospitals or designated public hospitals for treating COVID-19. If these patients require oxygen support or breathing support, they can stay in the ICUs of the hospitals. For patients in relatively stable condition, we would appeal to them to stay in AW treatment facility and holding centers. Now, for the holding centers I mentioned, these belong to the 4th tier, and that is for patients exhibiting no symptom in stable condition with a relatively lower risk. We hope to implement this strategy to reduce deaths, severe cases, and infection.
CMP, what is the current CT value cutoff to test positive on arrival at the airport? And will that number change with the FHB announcing the new streamlined route-specific suspension mechanism today? And Professor Gabriel Learn said the use of antiviral oral drugs was still unsatisfactory and too conservative. Do you agree with him? And will HA further loosen the guidelines for the usage of the drugs? And lastly, Dr. Tony Koh said the HA found that 40% of the COVID-related deaths are obviously fatal due to the new coronavirus, and the other 3 to 40% do not seem to be directly related to the virus. Can you elaborate on these findings? Thank you.
For the first question on PCR test, all inbound travelers or inbound arrivals are subjected to test and hold at the airport at the temporary specimen collection center, and the government or the staff will collect combined nasal and throat swabs from the inbound travelers and send for testing by a PCR by a private contractor. There is no any cutoff. If it is positive, then the case is confirmed as positive.
About the oral antiviral medications, actually we are on the same directions that we like to have a more generic use of the oral antiviral drugs. And actually, at the moment, we have prescribed more than 18,500 prescriptions to the patients on that two oral antiviral drugs. Actually, we have tried to broaden our channel to prescribe the oral antiviral drugs, namely the CIF, CTF, the designated clinic, the hospital, and also I mentioned before that will be supplied by the CGAT colleagues to the OH home resident. For the private colleague, we have allocated certain stock to the private hospital. And as for the private practitioner, actually, we are actively exploring to allocate some of the stock for them to prescribe. But actually, for the platform of the prescriptions and also other liaison, we still need some more discussions. But we are actively exploring this. As for the death rate, our chief executive, Dr. Goh, mentions that the 40%, which is our preliminary finding. But actually, we are still undergoing some more thorough investigations and more thorough analysis. And we like to disclose at the stage that have a more comprehensive and a more broad view. So we will disclose the findings later.
下一位，嗰邊最後。
The gentleman at the last row. Good afternoon, I'm from Ming Pao. On the oral medication, I would like to know the extent of usage so far. In answering a previous question, you have said that you are actively exploring with private medical practitioners on prescribing these medications. Are you talking about doctors in different districts? Is it going to be done on a strict-by-strict basis? And what other factors would you consider in allowing private medical practitioners to prescribe these drugs? As for the preliminary investigation into the mortality cases, how long will it take for the entire study to be completed? And when can you announce the results? According to a preliminary study, what conditions would be considered as sufficient evidence of dying of death by COVID? And what kind of data are you expected do you expect to get from the study, and how would it guide our future treatment of these patients? And lastly, a question about AWE. When do you expect that you can really operate 400 odd beds? This morning, the CE said she would expect more than 400 to be admitted in the near future. So exactly when would that happen? And under what circumstances would you trigger the mechanism to get more helpers from the mainland? As I've said, we have prescribed 18,500 cases. There are more MSD cases than the other one. We are talking to the private doctors, and of course we will try to tie in with this by maintaining the right stock level. But we have to find out how the prescription can be done and how can the patients really get the drugs. There are some finer details that we need to work out with the doctors. On the question of the death cases, as I've said, we have got some preliminary data, but we still await further details to be looked into. But we cannot say that there's one single factor that can determine the nature of the case. We have expert advice, and we will announce the results as soon as possible. As for the treatment center in AWE, we hope very shortly we can work at full capacity, i.e. Operating 450 beds. If you ask, how are we doing in terms of manpower deployment? Well, we already got what we need. But are we going to deploy more, or are we going to operate more halls? Or a lot would depend on how the epidemic progresses. Given the circumstances at present, what I would say is that we need to be vigilant. We need to monitor the situation closely, but a lot would depend on how the epidemic progresses from now. I'm from AM 730. As for RTD CNT statistics, well, can you tell us the number of cases involved and how many, and the percentage of confirmed cases? And there was a case who said that a patient was sent to hospital and the resuscitation failed to revive him. And are you going to look into the difference between die of or die with COVID-19? Well, according to a press report, there a 60-year-old woman was found dead on arrival. Well, our colleague in Taipo did receive a patient with similar conditions. She passed away at 11:21 a.m., but the patient was tested negative using RAT. But of course, we need to consider different cases surrounding the death cases. As for the use of such data or observations, or I would say that in terms of the future guidelines for prescription drugs, and also if we had another peak, then we'll be relying on the information that we have learned from the current study. As for CTN, after its resumption in the past week, we have been getting more samples from our community test centers. Some 70,000 people went to the community test centers or mobile test centers. Some 6% of those became confirmed cases subsequently. As for CTN, the residents will have to do the test on the very night of the day of the order. So we will know how many cases are positive, and we will announce the figures through our press releases.
CTNs are different because members of the public subject to CTNs are required to go to the community testing centers or mobile stations. They can also go to accredited private lab services for the test within the specified period of 2 days. The government will conduct inspections, and some buildings will be selected. These are buildings subject to CTNs, and the government will check how many residents have complied with the CTNs, and this inspection will be carried out by the government. Next, I'm from Hong Kong 01. I have a question for Hospital Authority. Just now you mentioned that elderly people who find themselves unwell should visit the hospitals as soon as possible. Is it your observation that some people had arrived at the A&E unit late? Another question for Dr. Au. Previously, because of massive cases, you couldn't perform contact tracing. Now that the number of confirmed cases have dropped to a 4-digit figure, is it possible to resume contact tracing? What do you think should contact tracing be resumed when the case numbers have reached a certain low level? Now, another question, how many such emails have you received regarding people making inquiries about certificates of COVID positive, about allocation of beds and the triage strategy? After they've been implemented, we have been able to run the A&E units smoothly. For patients waiting at A&E units requiring hospital admission, we're still experiencing immense pressure, but we at the same time appeal to anyone feeling unwell that if it is urgent, you can visit the A&E unit. About contact tracing, at the moment we have 8,000 to 10,000 confirmed cases per day. It remains at a high level. Our current strategy is to focus on the confirmed cases, and that if necessary, these cases should either be isolated at home or be sent to a community isolation facility. For household contacts, these family members are basically contacts of the highest risk level, and they should be quarantined. We also make use of the online platform to collect information about confirmed cases, such as their occupation, place of work, and their address. And then we also analyze whether certain buildings are of high risk, and this will form the basis for issuing CTNs. And once the confirmed cases further drops in number, then apart from household contacts, we can perform contact tracing for other close contacts. At the moment, the members of the public are by and large observing social distancing measures. So at this moment, we consider household contacts to be of the highest risk. Our contact tracing effort, therefore, focuses on household contacts. Subject to manpower, resource availability, and isolation facilities availability, we may revert to the mode of contact tracing adopted in order to achieve dynamic zero infection. As for the RAT reporting online declaration, we appeal to anyone who tests positive to report to us via the platform as quickly as possible. There should not be any delay. if you test positive, you should report to us the same day or the following day. Otherwise, you will not be able to report to us via the platform. It is important because we need to issue an isolation order against the infected and a quarantine order for the household contacts. If there is a delay of several days, it will not help us curb the transmission chain and safeguard public health. So I appeal to members of the public to report to us as soon as possible. If, for various reasons, for example, if an elderly patient is unable to go on to the internet, then they can ring our hotline and explain why the case cannot be reported within 2 days. These cases will be decided individually, and we'll consider whether there is justification not to make the report within 2 days. For example, if possible, a family member should help make the report so that we can issue isolation and quarantine orders, respectively. Otherwise, under normal circumstances, I still encourage members of the public to report to us as quickly as possible. If there are no other questions, that's the end of today's press briefing. Thank you.